Before you get married or enter into any serious relationship that is going to involve sexual activities, there are some important health related things you need to know about your partner. It is for your own good. Before we continue, if today is your first time of coming across my channel or this video, kindly hit on the subscribe button and turn on your notification bell so you don't miss any video coming from this channel. So there are some important health related things you need to know about your partner. Number one is the blood group of your partner. Very, very important. There are two blood grouping systems. We have the ABO blood grouping system, which are the A, AB, the B, and the O. And if you can remember very well your blood group, you will notice that it is not just AB, AB, or O, but there is either a negative or a positive attached to the ABO blood grouping system. Therefore, you have it in this order: A positive, A negative, O negative, O positive. The positive or the negative attached to the ABO blood grouping system is the second blood grouping system known as the Rhesus factor. This Rhesus factor is a protein that sits on your red blood cells. If you have it on your red blood cell, then you are positive. If you don't have it, then you are negative. And they are inherited either from our mother or from our father. And this is where the problem lies, not with the ABO, but our interest is with the Rhesus factor, because there can be incompatibility with the Rhesus factors. For instance, let's take a man who is A positive, get married to a woman who is A negative, and this woman gets pregnant. The baby in the womb will either inherit the Rhesus positive of the father or the Rhesus negative of the mother. In this our situation, the mother is even negative, meaning that she doesn't have the protein. So the possibility of the baby inheriting the Rhesus positive of the father is high. And if that is what happens and the baby is Rhesus positive, the baby's Rhesus positive blood is going to leak through the placenta into the mother's blood circulatory system. And the mother's Rhesus negative immune system will then detect the baby as an intruder or as a foreign material, and therefore will build up antibodies to go and attack the red blood cells of this growing baby, and then will destroy the red blood cells of the baby, break the red blood cells of the baby, and that will lead to what we call hemolytic anemia disease, which can cause serious anemia, jaundice, damage to the baby's organ, and even it can lead to miscarriages, death of the baby. So this is why it is important for you to know the blood group of your partner before you marry such a person, even if you are in a relationship, because anything can happen. You can get pregnant whilst you are not married, so that as soon as you get pregnant, and go for the Rogam injection that will neutralize the effect of the antibody and the Rhesus positive blood, and you'll be okay. But usually the first pregnancy will be safe. You deliver such a child, I mean in good health. Nothing will happen to such a child, because it takes a longer period for the antibodies to be ready to fight against the Rhesus positive embryo or baby. By the time the antibodies will be ready, you would have delivered your first baby. But the soldiers or the antibodies will be ready, waiting in the mother's system for another Rhesus positive baby to attack. So the subsequent pregnancies are going to be in serious danger. Therefore, it is good that you know the blood group of your partner, so that when you get pregnant, quickly go for the injection, the Rogam, and that would neutralize every effect. The number two findings you should know about your partner is the genotype, the part I fear the most. Hemoglobin genotype, which a lot of people mistake for blood group. Blood group and hemoglobin genotype are two different things. The blood group are the ones that comes with the positive attached, but the genotype are the AA, the AS, SS, the SC, the AC, and we even have other two which are not common. So we not even go there. Let's stick to these few ones. So we have A genotype, which is a normal hemoglobin genotype. We have S, which is an abnormal hemoglobin genotype. We have C, which is also an abnormal hemoglobin genotype. So this order, but the genotype comes in pair. It is either AAAS, because you inherit one from your mother and you inherit the odd one also from your father. So they come in pairs. So if somebody is having genotype AA, what it means is that the person is having two normal hemoglobin genotype, and this person is normal, will live normal life, will produce normal red blood cells, will not suffer from any, sickle cell disease crisis. You are just normal. And if you are AS, you have one hemoglobin genotype being normal and one hemoglobin genotype being abnormal. But because you have one that is normal, the one that is normal is okay to produce enough normal red blood cells for you to live a normal life. So you also not experience a sickle cell disease, crisis, or whatever. You live normal life. You are just a carrier, or you just have the trait in you. That is all. If you are SS, all your two hemoglobin genotypes are abnormal, and such a person is a sickle cell disease person. You are going to produce abnormal red blood cells, going to suffer from sickle cell disease crisis. You'll be in pain, you have anemia. At times, your organs can even be damaged. You understand? So therefore, if you are going to marry and you are AS, make sure you don't go for somebody who is AS. Even though you two are okay, but your offsprings are going to be SS. That is a sickle cell disease children. And even if you are not lucky, all your children can even be SS, and you are not ready to go through the trauma these SS kids are going to bring. You always be roaming from one hospital to the other. You will be spending money, your time, your energy. You will not even be happy in your marriage. Tell me, which mother will sit down or father will sit down and see the children suffering and will still be happy? No, you'll never be happy. You understand? But if your partner is AA, that is all. It doesn't matter your genotype. Whether you are AS, SS, SC, AC, you are free, just because one partner is AA, having all the two hemoglobin genotype to be normal. This alone will overshadow all the other effects. You marry, you can give birth to healthy children, and you have nothing to worry about. So it is very, very important. With a genotype, I tell you, if you guys are not compatible, call the relationship a quit. This thing, it goes beyond love. But with a blood group, you cannot create a relationship because of blood group. No, you cannot do that. But with a genotype, my sister, my brother, it's advisable. If you guys are not compatible, you just call it a quit and move on. Third findings you should know about your partner is the sexually transmitted disease status of your partner, like gonorrhea, chlamydia, syphilis, HIV, hepatitis B. These things are communicable, diseases, or they can be transmitted from one partner to the other. So it is very important that you know the status of your partner, because most of these sexually transmitted diseases can be deadly at times, like syphilis and then chlamydia. Syphilis can be on you for a very long period of time, for so many years, and you may not even know, and you can pass it on onto your partner. And if it's a female partner having this condition, syphilis can even affect the reproductive system of a female and will make, getting pregnant a bit challenging for the female, and also lead to abnormalities in childbirth and stuff. So all these things, and chlamydia as well, HIV, if your partner is having it and transmit it to you, you can even pass this HIV on to your children, and Charlie, that will be a disaster. So you need to know all these things in order for you to know what measures to put in place in order not to, transfer it to the other partner, or in order for you to know the kind of treatment you can start as soon as possible. Then number 4 findings you have to know about your partner is the fertility status of your partner. Ladies always go through this fertility status, peacefully. They take their pelvic scan or their transabdominal, transvaginal scan to check, their uterus, to find out if everything is cool with the uterus, their ovaries and their fallopian tubes, check everything. They do their hormonal X-ray, check their hormones to see if they are in the normal range or they are not. When it comes to the fertility status, this is where the guys most of the time dodge. This is because there are 2 main tests that they will be asked to do, especially one, which is semen analysis. And the method of collection is either through coitus interruptus during sexual intercourse. When you are about to ejaculate, you pull out and pour it into the container and bring to us, which is preferable, or through masturbation. But because of our religion and belief system, no sex before marriage and masturbation is a sin, the guys most of the time don't do this semen analysis. Even their, marriage counselors don't even include these tests in their tests they have to run. So it makes it so easier for them to dodge. But for the testosterone, guys should be able to do testosterone lab. Testosterone is what makes you a man. It is what regulates your sexual life. You understand? It is responsible for all the masculine features, like the deepening of your voice, the beard, the broadening of your chest, the muscles and stuff. So it is very important you also, check for your testosterone level and know if it is high or it is low, it is within whatever. So it is important that you know the fertility status of your partner, especially now that issues of infertility is on the rise among, married people. So it is important to know before you enter into such a marriage. And the last thing you have to know about your partner is chronic disease status, like asthma, diabetes, hypertension. These things you need to know. For example, you need to know if your partner is hypertensive, you will know how to behave around your partner. You don't do things to provoke him, because if you do things to provoke him, it can trigger the blood pressure to shoot up, and that can be very disastrous. You understand? If your partner is asthmatic, you should know that a certain smell, certain scent, food flavor can trigger the asthma. You don't put on strong scented perfume around your partner, because all these things can trigger the asthma. If your partner is diabetic, you will know the kind of food to prepare and serve your partner. All these things are important. You need to know before you enter into such a marriage, before you enter into such a relationship. Know all these things because it will help you. You understand? Thank you for watching this video. Once again, if today is your first time of coming across my channel, kindly hit on the subscribe button, turn on the notification bell so you don't miss any video coming from my channel. I will see you in my next video.